DW Africa Link. Yes, we can end TB. Led by countries, powered by people. That's the theme for this year's World Tuberculosis Day. It's a strong reminder of a disease that is both preventable and curable, yet still one of the deadliest. So if the tools to stop TB already exist, why is it still such a deadly threat across Africa? And what more solutions can be explored?
South Africa remains a high-burden TB country. We still experience deaths. 54,000 people die per year, which is a big number. But we've done very well in terms of finding people with TB. We've closed the gap between the one we find and those we don't. And we've been really decreasing incidence. We decreased our incidence of TB by 61% from 2015 to now. So that is really good progress.
That's what's coming up. I am Eddie Micah Jr., and you are welcome to Africa Link, the podcast connecting you to the stories that matter. Africa Link, every weekday here on DW. Tuberculosis continues to infect millions every year and kills over 1 million people globally, often because it's detected too late or not at all. Africa carries around a quarter of global TB cases, but nearly a third of all deaths. Countries across the continent are still battling high infection rates. In places like South Africa and Mozambique, thousands of cases go undiagnosed each year, allowing the disease to spread quietly through communities. For more on this, let's bring in Helen Hallstrom, Senior Partnership Officer at ADPP Mozambique. That's a non-governmental organization focused on development aid from people to people. I also have Tuzo Kumalo, DW's correspondent in South Africa. Hello and welcome to Africa Link. Tuzo, let's start with the reality on the ground. How visible is the TB crisis?
In South Africa on the ground, the TB crisis is still visible, I can say. The numbers tell so. For example, a study done by the University of Cape Town revealed that in 2023 alone, about 270,000 cases, new cases, were registered. So it's showing you that TB is still visible, still there. And of course, overall in numbers, in terms of numbers, we've got about 468 people per every 100,000 people still struggling with TB. And looking back into 2023, again, you had about 56,000 people who died in that year alone. So it's showing that TB is still not going away. But I think there are also kind of answers to this. South Africa has one of the highest incidence of HIV infections. We know that HIV and TB, they are always close to each other. About 8,000 people living with HIV and AIDS. So it gives you a picture as to why South Africa still struggles now when it comes to that. If you look at the numbers of the people infected by HIV, over 50% of those people, they are also co-infected with HIV. This link, I think, is one that makes South Africa keeps on struggling, because even with HIV, there are new infections, meaning that can be translated also to say, even with TB, we've got those cases going. So South Africa is still struggling so much, but of course, there have been some improvements and achievements done by the government in that space.
Right. Thanks, Tuzo. And we'll definitely be spending a lot of time looking at some of the achievements and the solutions moving forward. And I'm going to come to you, Helen. How does Mozambique compare to South Africa when it comes to TB cases?
South Africa has definitely a higher burden than Mozambique, as he said, because of very high HIV infection. But in Mozambique, we have around 100,000 people who get TB every year, with an incidence of 361 per 100,000 people. And the co-infection with HIV is part of driving it, but we also have high chronic malnutrition, and still a lot of people living in poverty, which is also part of driving it. So Mozambique is definitely one of the high burden countries struggling with high TB burden as well.
I found it interesting, the correlation or connection between those that have been infected with HIV and those getting TB. What's the connection? Can you help us connect the dots, Helen?
People who have or are living with HIV get often a lower immune system if they are not adhering to the treatment and in general living a healthy life. And in a country as Mozambique and as well in South Africa and many other countries, the latent TB is very high. Actually, on a global scale, 1 in 4 persons has latent TB, meaning we have the bacteria, which is sleeping, so to say, and when our immune system gets low, we can get tuberculosis, and that's what is spiking the high co-infection HIV and TB as well.
That's interesting, learning a thing or two here. How do I know that I have TB? I mean, it may seem like a very simple question, but some people may have it and not know it. What do we look out for?
So we are looking for where you start to lose weight, you start to cough. Some people, they might think they have got maybe some more allergic reaction, asthma, but it's a persistent cough and you have night sweats. These are the most common symptoms, but it's also important to know that some do have TB but are not showing the symptoms immediately as well.
Now, let's hammer a bit more on that because, yeah, if I don't know that I have TB and yet I'm spreading it all around, how then do people know to go and check it if they are not showing any symptoms? That just sounds very like extra deadly to me.
Right, it is. You can say the majority do have the symptoms. But what we can see is our experience in Mozambique is people are often mistaken TB by being a bad spirit or think it's something else, which is delaying going to the health facility and being tested. So for those who do not have symptoms, that is where you can only get to know it by actually going and being tested.
That will almost suggest regular checkups just in case. Because all of this is probably one of the reasons why TB is still killing quite a number of people. Because from what I know, tuberculosis is curable, right? So if it's curable, why is it killing so many people?
Yeah, that's a very good question. So what is often driving is a weak health system, which impact late diagnosis, the poverty, and those underlying factors, as we talked about before, as malnutrition, co-infected with HIV. In other parts of the world, there is also high alcohol abuse and diabetes as well, which is lowering the immune system.
That's rather unfortunate. Tuzo, I know you're listening. I've not forgotten about you, so I'm coming right to you because people are also not coming forward to test, right? That is one of the main challenges also, even if they are showing symptoms. Is stigma still a major barrier in South Africa, Tuzo?
Yes, indeed. Stigma is still a major barrier in South Africa. It's a major issue, in fact. And we know that once there is stigma, it affects the number of people that come forward to be diagnosed, and of course, the people that come for treatment and the care that can also be given to them. So this is just a major issue, depending on a number of issues. We have got what we call internalized and experienced stigma, whereby those people who are infected, they feel isolated by people, because once you cough and you're inside a crowd, the tendency is that, oh, you've got TB, please go to the clinic and get help. So that on its own, the way people, those that are not infected, view those that are infected, causes also them to feel isolated and to feel bad about it. And you can also tell that it's hard for them to be assisted, because already they are seen as a danger to other people's health. So that's one part of the stigma. But you've got also this association of HIV and TB is causing a stigma also, which we call dual stigma, whereby people feel that once we've got TB, then we've got HIV. This is a concept that people create in their minds that is not true, of course. But so that association makes people with TB also feel like they want to hide. They want not to reveal it, because once they reveal it, they will be associated with people classified together with people living with HIV, which of course also is another stigma that we find in the HIV circles. But you have got also the public hospitals, where sometimes people with TB are made to queue on their own, or it's known that that office, once you go inside, you have got TB. So that makes people with TB also shun from going to those public hospitals or clinics, because they know there'll be the cover sort of will be revealed. People will know that they've got TB, and people suspect that they've got HIV. And of course, friends might isolate them because they think they will infect them. So stigma becomes a problem also determined by the location. You find that people in a rural setting where there is dust, where the housing is bad, they are always associated with a number of diseases. So once they catch TB, or once they come into cities where things are clean and everything like that, they feel shunned. They feel they don't fit in. So stigma is becoming a big problem. And as a result, we have got these people failing or avoiding to come out openly. And once they do that, like our expert said, the effect of that is that they then infect others, because they don't get treatment. They don't get things that will protect others from this infection. So that stigma becomes a causer of more and more numbers of people getting HIV. Well, TB, sorry.
Right. And I mean, look, it's very sad what stigma can do, because if that wasn't so prominent, it will save so many lives. And talking about saving lives, hospitals, they also don't seem to have enough space to deal with all the people that need assistance. And this is where I'm sure an organization like yours comes in, Helen, ADPP Mozambique, because one thing that stood out for me, development aid from people to people. And based on research from your organization, I understand that communities are playing a key role in trying to tackle TB. Tell us more about that, because I found that more inspiring.
Yes, to fight TB, what we can see, it really needs to start engaging with people in the communities, with the communities. So looking at, for example, the issue with stigma. The stigma is very high among people, the auto stigma and the family stigma. So by ensuring people get more access to information, to know what is TB and how can you prevent it, and what shall you do in your family when one of the family members has got TB. So instead of stigmatizing and discriminating the person, you know what to do and take good care of the person, so that he or she actually can complete the treatment, which is on the contrary the challenge that we are facing, especially because the myths and misconception of TB continuing being a big issue. So we are working with various approaches, and one of the approaches is called One Impact, where we are using a digital tool. It's a digital platform, which is actually also been implementing in more than 23 other countries, which was initially developed by Stop TB Partnerships. which we then have adapted to Mozambican context and likewise in the other countries where it's implemented. So through this approach, we are engaging TB survivors who are the champions, reaching out to other people with information about TB. And through the digital tool, they support people where they can report barriers they are facing related to TB services, stigma, discrimination, human rights violation. So that these reported barriers, you will have an evidence of what is going on in the community, so that the community, with the TB champions, community leaders and other actors in the community, together with the healthcare providers, work together on looking at this information and take action so that these can be solved. And one of our experience is, for example, stigma. It's very high, and the community can take the ownership and actually solve majority of these barriers, which in turn is impacting that people continue improving the treatment adherence, and people who showing signs and symptoms are early aware and seek the testing, and people get more support through the treatment journey.
Integrating community-led digital reporting into TB programs, not just reporting, but education and, creating awareness of it. And, when always we talk about community-led programs, and in most cases, like in your case, using digital apps to try to deal with this, I always wonder about how scalable it is and the challenges that, may prevent it from doing its job. So solution-wise, how scalable is digitalization and, using the community to tackle TB?
It is scalable because you have the whole complete system. Of course, in a country as Mozambique, where we are using an app, people in the rural communities, they do not have a smartphone, and majority of people affected by TB in the rural communities live in poverty, so they don't have it. Therefore, we have adapted, so we are implementing using an assisted model where we have TB champions as a TB survivors who assist others in reporting when people are facing the challenges. There are various ways how you can adapt by using the digital tool. So the digital tool and the platform, it is scalable, and it is about finding the people who can provide the access to others. It can both be healthcare providers, it can be TB champions, it can be members of community health committees by providing easier access. But it is, you can say, a community surveillance system where the communities takes the ownership, and that is what is the key.
Right. Thank you very much for that. Tuzo, I'm pretty sure it's a similar situation in South Africa where people are trying to come together to find ways to deal with it. How is the government supporting to fight this disease in South Africa?
Yes, I think the government is doing its best, but what has happened here in South Africa is that after the withdrawal of the US aid, certain programs started folding because, of course, the government is doing the main bit in the hospitals and in the clinics, but mostly the sector that involved communities was funded through funds such as US aid, where you had community outreach programs. You've got community workers who were paid differently from the main, the core business of the government, paid by these NGO receiving this money. But since the withdrawal of this aid, you have seen that kind of weakening, but the government is trying slowly to fill that space. But remember also, the fact that this sector collapsed when the funds were withdrawn, it means the people who were there are now coming into the mainstream in government clinics and hospitals. So that's also causing patterns. But you have got activities such as community health workers are still going into communities, making these visits and also carrying out screenings, offering health education, and that also helps, especially communities that are far away from towns where transportation is difficult. This service comes handy for them.
The positive aspect of it, too, so from what you said, is that there are still local generated solutions that are going on in South Africa. And that is, I believe, the way to go. But I'm going to come to you, Helen, to wrap this up. At the end of the day, Africa needs to fight TB. There are a lot of diseases back in the day that used to be horrible, claiming so many lives. And now we probably don't talk much about them because, you know, technology and commitment from people and governments have helped come this far. What is the vision? What is the light at the end of the tunnel that you see for TB in the coming months or years? How optimistic are you that this will also be a killer disease in the past?
So in the period of 2015 to 2024, there have been a 28% reduction in the TB incidence. And there's been a 46% reduction in TB deaths. And there are also countries in Africa which has reached the 2025 target in reducing 75% related to TB deaths, which include Mozambique, Togo, Zambia, and Tanzania. And South Africa did also reduce or reach the target to reduce the TB incidence. So there are progress, and this is very much also because of strong community engagement. So my belief is continuing investing in the communities, in taking the ownership and working on the localized led solutions will definitely support that we can achieve much further in gaining control and eventually eliminate TB.
I like the way you're not being the prophet of doom, Helen. You're looking at the glass half full and really pointing out that over the years, there's been maybe slow, but there's been improvement in so many ways of tackling TB. And that is a good way to go, which means that the fight is on. And while challenges persist, there is clearly light at the end of the tunnel. And that is very important for us to wrap this discussion on. So thank you very much for that, Helen Hallstrom, Senior Partnership Officer at ADPP Mozambique. That's a non-governmental organization focused on development aid from people to people. Also, many thanks to you, Tuzo Kumalo, our correspondent in South Africa.
Thank you.
Thank you very much.
Picking it up from where Helen left off, indeed, positive strides have been made when it comes to testing and treatment. But still, gaps remain. People in South Africa are still being missed, especially the most vulnerable.
And when I came back for the results, they told me I have TB. So, but it was just after they told me I have TB that I've started to get the symptoms like the sweating and couldn't eat, and then I lose a lot of weight.
We have launched an NTB campaign where we must test 5 million people for tuberculosis annually, test them and put them on treatment every year. This is a mammoth of a task. The department, together with the National Institute for Communicable Diseases and National Health Laboratory Services, we launched what we call near live TB public facing dashboard. That dashboard is going to help you. All these 5 million people who are going to be tested, you'll be able to follow up. You'll be able to know which gender was tested that day, in what village, how many people tested.
Meanwhile, community health workers are bridging the gap between clinics and the people who need care most. At the same time, digital tools for tracing and treatment adherence are making it easier to keep patients connected and on track. It's a reminder that while the challenge is immense, solutions are already working. And with the right investment and political will, ending TB is within reach. What do you think? Share your thoughts with us on Facebook at DW Africa. Listen on Spotify or wherever you get your podcasts, and subscribe to our DW Africa YouTube channel so you never miss an episode. This show was co-produced and edited by Isaac Mugabe, and I am Eddie Micah Jr. Thanks for listening.
DW Mid